Good afternoon, everyone. I'm Victoria Foster, the Associate Director of ISR, the Institute for Social Responsibility, and it's a pleasure to welcome you to this launch of the research report, The Wellbeing of Homeless Families and Service Providers in Cork, Ireland. ISR funded this research, which explored the impacts of COVID-19 lockdowns on the wellbeing of homeless families and staff at Good Shepherd, Cork, a service working with homeless families and children in Ireland. The research focused on what worked during the pandemic with regards to service delivery, the use of PPE, remote working, increased adoption of technology, and social distancing during a period of global crisis. A narrative approach was taken to explore the well-being of staff and service users. And this can be a really interesting and illuminating way to do research, actually listening to people's stories. And the principal investigator, Dr. Lisa Moran, who's presenting today, has much expertise in this methodology. Lisa's currently Senior Lecturer and Head of Departments of Social Care and Early Childhood at the Southeast Technological University in Waterford, Ireland. However, she was based at Edge Hill in social sciences for several years until recently, and she's very much missed here. Lisa's principal research interests include biographic narrative research, emotions and lay knowledge of farmers and vets, transformations to social life post-COVID-19, and children in care. She's the Vice President of the Sociological Association of Ireland and a member of the Executive Board of Research Network 3 of the European Sociological Association. And Lisa was assisted with the research by Liam O'Farrell, who's also presenting today. Liam's a multilingual mixed methods researcher with lots of experience of managing projects and small teams in universities, the civil service, and think tanks. He's a particular interest in international comparative studies and has worked in lots of European countries. His research interests lie in understanding the causes of inequality and drawing from international best practice on policies that can create a more inclusive society. So Lisa and Liam are going to talk for about 35 minutes or so, and then we've got time for a Q&A. So could you please type any questions and comments into the chat as they occur to you, and then I'll pose them to Lisa and Liam after the talk. Okay, I think I'm handing over to Lisa now.
Thanks very much, Victoria, and thanks for such a lovely welcome and a lovely introduction. It's always lovely to hear from Edge Hill and to collaborate with Edge Hill because you've been absolutely fantastic. So thank you very, very much. So hopefully everyone can see my screen there. Okay. So today we're going to talk, as Victoria said, about a report that Liam and I have worked on in partnership with the Good Shepherd Cork. And I see Alison and Linda here. So thank you very, very much from GSC. And the report focused, as Victoria said, around the well-being of homeless families. We started off the report thinking that this would be a small scale project and that we would work with homeless families interviewing, doing biographic narrative research interviews. That didn't quite work out. So there were a couple of changes that went along as happens in most projects where things are very, very organic and things happened. And yet we ended up with some magnificent data, I would say, of exceptional richness and exceptional depth. And there's a reason that we chose this kind of mosaic looking piece here on the right hand side, and this relates really to the depth of the data and the kaleidoscopic mosaic type data. I always interpret it as multidimensional, kaleidoscopic, and also as mosaic like, because you're pulling together the mosaic of people's life worlds and lived experiences when you use narrative research. So for the next 30 minutes in and around, we'll talk about the background of the project, give you a description, the collaboration that happened between me and Liam. We'll talk about some international and national research evidence around well-being in relation to persons who find themselves homeless. The methodology, as Victoria said, which is very much around stories, storytelling, going deep into people's lived experiences, some implications for practice, and we can also talk about some of the outputs. So this is us. So Victoria has already talked about us. So I'm Lisa, and I'm very much a qualitative researcher, even though I have experience doing large-scale quantitative research as well in the past, but I'm very, very much grounded in the notion of narrative. And this is something that's kind of intrigued me and entranced me for several years. How do people narrate the worlds around them? So I was so lucky during this project, not only just to work with ISR and to receive funding from Victoria, Joe and colleagues, but also that Liam came on board as the research assistant. And what has really happened is that we formed this really good friendship, even though we've actually never met in person. But we each bring a very deep understanding of qualitative methods, what they mean, how to apply them. And Liam, you might like to say something here very briefly about yourself in relation to your experience interviewing homeless families, and because I know you come very much from that social justice background.
Yes, thank you, Lisa. Well, my introduction's already been said by Victoria, but my background is mainly in doing smaller research projects, in working as either a research assistant or a research associate. I've done that in the UK, in Iceland, in Ireland, and in many other European countries. And as I said, my particular interest is in inequality. And my first experience of working with people who were sort of extremely marginalized was on a project in Birmingham some years ago. And that was really a great learning experience for kind of the most ethical way to research people facing adversity, because I think it's really important in these kinds of projects not to be exploitative and just extract sort of research data from vulnerable people and then sail off into the sunset with, you know, your beautiful report or publication or whatever, and the people who've been left behind, you know, they've gotten no added value from that exchange. Which is why I'm really interested in how we can take the data and not just make academic publications, but also recommendations to improve the lives of the people who are impacted by the things we're talking about. And I think that's what's great about this project. And the report that's come out is really focused on the Good Shepherd Cork and on homelessness in Ireland and beyond, and making some recommendations about that. So I'll stop talking now. Thank you. Thank you, Lisa.
No, that's brilliant. Thank you very much. So just to give an overview then of our own research biographies, and I associate myself very strongly as a biographic narrative researcher, and I've got a really strong interest in COVID-19. So I'm working on a co-edited book at the moment with Ludmilla Nurse at Oxford and Maggie O'Neill in University College Cork on new social architectures during COVID-19. I also got a book contract myself, and I've now involved Dr. Zita Dooley in this with Springer in relation to stories of the pandemic. So really since 2020, I've published quite a bit in relation to COVID-19, presented across the world on scientization, governance cultures and decision-making during COVID, especially with Lorraine Green, who's a staff member and a dear friend of mine in Edge Hill. I come from a background very much in sociology of scientific knowledge and trying to understand the origins of science, what the nature of scientific knowledge is, and how particular types of diseases, whether they're animal diseases or human diseases, how they're framed in relation to science, and also this kind of qualitative research that already exists on the processes of diagnosis. I've also published on the possibilities and the barriers of interviewing online with my colleague Anna Catano in 2021, and that becomes more significant later on. But some of the other things that I'm interested in are child welfare, family support, emotions and human-animal interactions, but also permanence and stability for children in care. So some of the other projects that I've worked on recently as well relate very much to family and the reconstitution of family in more recent times. For instance, a book on mothering, which is coming out soon with Bristol University Press. Also some special issues of journals that I have around COVID-19 and transformation to sensory experiences, but also other work that I did with the International Sociological Association, the European Sociological Association and the British one on temporalities and this new what we call viruscapes in society. So I'm also supervising a PhD on the transformation of touch during COVID-19 in nursing homes. So Liam, do you want to come in now?
Yes, sure. I will be very brief. So my research background is mainly in urban and economic development, and I moved from first being in the civil service to think tanks and then into academia, still keeping that focus on policy. And as I mentioned, the first big project I was involved in was in Birmingham, where we had a project that was working with homeless people, people in social housing, people in very sort of marginal conditions. And based on that, I got really interested in engagement and participation. But that was across different contexts, as I mentioned. So there's a couple of papers coming out about work I did with a colleague in Iceland on that, and a couple that came out late last year or early this year, based on the work in Birmingham. And on the flip side, I'm also doing a PhD. It's been, as I was saying to Victoria before this started, by the time I finish, it will have been 11 years since I first applied for a PhD. So it's a very slow process and it's changed a lot, but it's also looking at the flip side of that, which is built environments, which are shaped by the super rich and how they kind of have an impact on the local ecosystem, if we think of it a bit like a rainforest or something. I think that's all I have to say, Lisa.
Thanks very much. Okay, that's great. So just to give a bit of background then, in 2020, we sought funding and won funding successfully from the Institute for Social Responsibility. And I want to thank Joe and acknowledge Victoria and all the ISR team in relation to that. We used what could be described as a participatory learning and action approach, very much drawing on the notions of partnership and collaboration with our colleagues at the Good Shepherd in Cork. And this very much extended our interest in COVID-19, in processes of doing family, in the complexities of the everyday process of doing family. And what we were essentially really interested in, among all of the other things, was how the process of doing family, as in an active sense, changed under pandemic regulatory conditions, to do with masks, social distancing, and also the different types of rules, for instance, that were enacted in the Irish context. So Ireland was seen very much as an early adopter because there was a huge shutdown, an immediate and rapid shutdown during COVID-19 in comparison, to other countries, which were seen as more laggards in relation to that. And we also used Sarah White's very influential work from 2010, 2012 on the concept of well-being, talking about well-being as very much a multidimensional concept. And within the literature on well-being, and there's obviously a lot of debate around what the notion of well-being means, etc. One of the things that's noticed is that sometimes people who are from very marginalized backgrounds, they don't use the word well-being in their everyday discussion. So we designed an interview frame where we pulled out proxies and tried to probe around particular types of proxies that were memorable or interesting or that were meaningful to people, and then linked this to the concept of well-being itself. So that's just some background around it. Liam, you're going to come in with literature.
Yes. So of course, like any project, we started off with quite a deep literature review, which we organized into 3 thematic areas. And the first was to look at the Irish, wider European and then international literature on how well-being and homelessness intersect and how that was impacted during COVID. So that obviously early on there was less literature on that as COVID had just come onto the scene, and now there's growing literature on it. And we also considered some of the digging into well-being, some of the structural inequalities or sort of longer term issues facing homeless people, whether that was healthcare access or substance and alcohol misuse, experiences of racism, domestic violence, intergenerational trauma. And then finally, coming back to the concept of well-being, really there's so many definitions of that, which is why we've gone with quite a loose or all-encompassing approach here, framing it as a multidimensional concept. It's covering knowledge, health, care, financial security, affection, friendship, person's emotional, relational, and material needs, and how that varies across the life course and context.
Yeah, exactly. Thanks very much. So just to give a bit of a context around homelessness in Ireland, we're living through a homeless crisis at the moment, and I see some of my Irish colleagues and friends have joined, so welcome. A lot of research has been done in recent times, particularly by the Housing Agency in Ireland, and from a sample, for instance, the Housing Agency concluded that there was a very high incidence of mental health issues and also elongated percentages of people who had, apologies for that, diagnosed disabilities in 2018. Curran and Hoey also found that there was increases in substance abuse and increases in relapse amongst people who found themselves homeless. Finnerty et al. From UCC, who did an awful lot of work on homelessness in the past and the experiences of homeless people, found, for instance, that during COVID-19, there was a heightened anxiety. People were afraid of losing beds and also of being a close contact. And FASIM 2021 found that there were rises in boredom, sadness, sleep disruption, irritability, and weight fluctuations. So in relation to well-being, we were interested in people's subjective well-being, how they described the impacts on their emotions, on their physical health, on their relationships. So again, drawn in Sarah White's perspective very strongly into that. There's also a burgeoning literature around homelessness service providers and the impacts of COVID-19. So while we frame this very much within a life course approach, and our outputs are very much drawing on the notion of the life course and what happens at particular phases of the process of storytelling, we also found that the sample of homeless service providers themselves, so people that work and that are affiliated with the Good Shepherd, could actually be very well placed within this literature, and that there were a lot of experiences that our interviewees were telling us that very much reflected the currents within the literature. So Goodwin et al., for instance, found that there was these discourses around how do we do our jobs. Everything was changing every day, and the rapidity of change and the secular nature, if you want, as well, of change, and also the importance of organisational supports to deal with these kind of blurred boundaries that there are between home and work. And we all know many of us work from home, particularly those of us in higher education, but people who are in services as well, they also work from home during COVID-19. And this sense of powerlessness that there was among service providers, that they could really not enact change in people's lives in a meaningful way. Whereas others have provided other solutions, drawing on empirical data, saying that a culture of care is needed that's based around teamwork, adaptation, and feedback, and that these three prongs, if you want, are really, really valuable for helping people who are in these types of supportive roles to support other people. Whereas Carver et al. Found that there was an inability, this feeling of being unable to change the circumstances of others impacted on higher levels of burnout, and the whole notion of feeling less than other professionals, that their experiences were valued less than other professionals in the COVID crisis, such as nurses and doctors, also markedly impacted on ability to perform sometimes in one's own job. So just to give an overview, and this is direct quote from the report around what well-being is. So Sarah White adopts this three-pronged approach to well-being as embodying subjective, relational, and material dimensions. So as Liam said, it's very all-encompassing. And we found that this interconnected with our data in very interesting ways. And this was also a framework that Lorraine Green and I used in a publication last year that we wrote on parental well-being as linked to the long-term outcomes of children and young people who are care leaver students from a sample in the UK. So well-being, it's well recognised in the literature from White and from others, is holistic and relational, and it refers to things like human satisfaction, but also links very much to the material, the physical, and the emotional aspects of people's everyday lived realities. So optimal human well-being occurs when a person's emotional, relational, and material needs are being met, and crucially, when they're being met in proportion to each other. So what are some of the factors then that the literature says that affects well-being? Me? Nothing happening. Sorry, can't get this to work. Let's use this one here. Okay, hopefully that's all right. So we know, and as Liam said earlier on, the literature, for instance, draws a lot of attention to the factors that affect the well-being of homeless people, not just in Ireland, but right across the world. And we know that the well-being outcomes, both in and across time, are substantially worse for people who find themselves homeless or in temporary accommodation in relation to health, accommodation, and employment. And that seems to be a global statistic. But some of the interesting things is that the literature points to the importance of social support, in particular perceived social support. So the feeling of someone is trying to help me, whether the help is actually material, in other words, that you give somebody material goods, but it's the feeling of being supported is really, really important in terms of offsetting some of the negative factors that impact adversely on well-being. We know that social support, both formal and informal, and that can be a kind word, it can be a kind gesture, it can be having a conversation with a homeless person on the side of the street, is very, very important in terms of the mental health, but also in the physical health. And this is found in several studies, not just across the US, as quoted here, but also across Europe. And significantly, this Huang et al. Study found that the informal and formal supports, when they were in proportion to each other and targeted at the needs of specific people in relation to their own biographies, their own backgrounds, their own understandings, their own life course, actually decreased feelings of depression, anxiety, and also shame. And shame was something that we also found was potentially something that could have impacted on our sample, which we'll talk about in a couple of minutes. We also know that in the Irish context, homeless persons have been very negatively affected by COVID-19. And Lima 2021, for instance, talks about persons who are homeless being among the worst affected populations in Ireland by COVID. Whereas other work, for instance, Matson et al. 2023 from Canada, where they did a qualitative study of women who were in a homeless shelter. One of the predominant narratives that emerged in their data was that COVID-19 is really a storm in a teacup, because people said, well, actually, we have so many other things to look after and so many other things to worry about in relation to our children, having a home, having a roof over our head, having money to buy the very, very basic necessities. COVID-19 was just another thing to add on top of multiple oppressions. So our central research question was, how did COVID-19 impact on homeless families' well-being and the effectiveness of homelessness services provided by the GSC during the COVID-19 pandemic? So while this started off as being quite a small scale evaluation around service effectiveness, etc., in relation to well-being, we found that the depth of the narratives was very, very complex indeed. And you'll see some of that in relation to some of the things that we did with analysis later on, and also the length of the report. Some of the related research questions that we devised outside of that are, how has COVID-19 affected the subjective well-being of homeless families and staff members, which was really crucial. How do homeless families and service providers interpret well-being in relation to emotions, personal and professional experiences, and service users' biographical experiences, both before COVID-19 and during the pandemic? So one of the things that, in looking at the literature, that we didn't see very much of was actually biographical research, grounded very much in this story-based approach that looked deep into people's biographical experiences before becoming homeless, whilst becoming homeless, and then for people, for instance, who had exited homelessness. So we tried to build in biographical principles, key principles of biographical research in terms of looking at the interconnectedness of people's experiences, past, present, and future selves throughout the process. Some of the other related research questions that we had is, how do families and service providers experience and operationalize social distancing in temporary, cramped, and or inadequate accommodation? And there was very little research we actually found that was out there, which is one of the things that made our research novel and unique, was in relation to social distancing and how families react to social distancing, but also how the effectiveness that service providers felt, how effective that the operationalization of social distancing was in their services. How effective was the service itself for homeless families during the pandemic, as per service users and staff members' perspectives? What kinds of stressors emerged during the pandemic, and how did COVID-19 exacerbate other stressors that were already present in people's lives? And crucially, how did homeless families and staff members imagine their futures during the pandemic? So Liam, I think you're next on methodology.
Yes, that's right. So as Lisa already mentioned, we adopted a biographical approach. This was a qualitative research project, which we wanted to focus on how the participants in our research made sense of the world around them. and how they talked about the kind of inner world, their life world. So we analysed and interpreted the data that we collected at the same time as the collection, and that was so that we could integrate the themes and topics with what we're finding in the literature. So, as it says here, we began with a scoping review of the literature using the approach by Arksey and O'Malley. And for some of our key themes, they came through conversations with Good Shepherd Cork, who also guided us with regards to sampling participants. Owing to the lockdowns, we conducted all the interviews online or per telephone. Next slide, please.
Yep. Okay.
Okay. Oh, that's good. It's quite quick. Aims and objectives. And just to finish on the methodology, sorry about that. With this approach that we took, we found that it made quite a dynamic relationship between the data and the literature. So our aims then were these flow from the main research question that Lisa just presented. We wanted to understand the effectiveness of the Good Shepherd Cork as pair service users and service staff with regards to accommodation and related wellbeing needs during the pandemic. We wanted to critically examine discourses of subjective wellbeing among service users and staff. We wanted to analyse how COVID-19 impacted on people's wellbeing and identity factors that either offset or exacerbated social and emotional stressors, staff members and service users, and that was with regards to accommodation, family breakdown, relationships and other life experiences. And finally, we wanted to examine homeless people's reactions to restrictions in movement such as social distancing and the transition to shared accommodation during the COVID-19 pandemic lockdowns. And that related to this, we have a series of objectives which are distinct from the aims. The first was to conduct a scoping review of academic and non-academic literature on homelessness from Ireland, Europe and internationally. We wanted to conduct a series of qualitative interviews, either online or by phone, originally targeting homeless adults about the factors that led them into homelessness and their everyday experiences during the pandemic. Then wanted also to do interviews with Good Shepherd Cork service staff on the impacts of the pandemic on homeless families' lives and well-being, as well as their own professional and personal experiences. We wanted to build narratives and discussion from homeless participants on how they see their future and any gaps in the service and policy provision. And finally, we wanted to capture the impacts of new ways of working during COVID-19 on Good Shepherd Cork services, staff, and effects on relationships and building trust and rapport with services users.
Okay, thanks, Liam. So just to give you an overview then of some of the findings that we were able to elicit. So we could break them down, and we do this in the report, around 5 kind of key themes, which was life pathways into homelessness, experiences of marginalisation and oppressions, technology and ways of working, social distancing, mental health and personal coping, and social support and interagency working. And just to go back to this slide here for a second, so when I didn't put up, this has a purpose, like all of the other pictures that I have in here, this has a purpose. And part of the reason for this purpose is that I saw the interconnections between the data and the literature as occurring like in nodes. And I like this notion of where data and theory and data and literature intersect. And I saw it kind of as there or there or there, where there's a bigger light. So while we use thematic analysis, as you'll see in a second, we also went beyond this, using a much, yes, thematic analysis, but also extracting narratives from the data, which we think foreshadow and kind of foreground much of the other literature or data rather we were able to collect. Okay, so this is just a nice picture on life pathways. All right. So one of the things that emerged very, very strongly from both the staff members' interviews and also the interviews with homeless people was around the complex life experiences and the interconnectedness of the past, present and future. And this is something that Anna Catano and I talk about in something that we're going to submit tomorrow, is in relation to the complexity of the everyday lived life and the complexity and depth of every single so-called ordinary life experience. And while a lot of these stories of homeless people's experiences can be seen as very negative and also as very sad stories. They also are peppered with notions of the future self, reimagining what the self would look like or is going to look like down the line when they get a house or when they're in a better place. And they're also peppered with notions of agency and changing things for the better, for their own better. So there was also a lot of emphasis in the staff members' interviews on the importance of understanding the interconnectedness, if you want, the nodes of where the problems and the pre-life experiences, as well as the future self, coming together. And we thought that this was something that was really significant, that it's not just about seeing people where they are at that moment in their lives, it's also about understanding the previous life experience, but also the future self, as being important to understand people's needs and making just and good provision. So for instance, staff members said things like, just because they leave here, all the problems they had don't disappear because they have a house. You know, that still requires a lot of support. The needs have got higher and the work in general has got more demanding. And this notion of the demanding nature of the work and the profile of homeless people, people that were using the service, as changing, was something that came out very, very strongly. There was a very strong commitment among staff who were interviewed to their work and to helping to change people's lives and helping people to change. So one woman, for instance, says, you don't do this for the money, you do it because you're committed. Even if you're afraid, like during COVID, you can't disappear when things get tough. You still have to provide a service. So this was something around interconnectedness of experience that we thought was really interesting. And this was also peppered by a very, very strong commitment on behalf of staff. One of the things that we found in talking to homeless persons that were interviewed was around the notion of having epiphany moments. So moments, for instance, when in their narrative, they talked about particular moments in time where their lives became clear, or where there was a clarity of meaning or clarity of purpose, which they didn't have before. And this again was very much linked to the whole notion of storytelling and going into people's biographies. So one woman, for instance, that we interviewed made the following statement. So we would have grown up with not a lot. He preyed on that, her husband. I had low self-esteem, no self-confidence or self-belief. I never had any counselling before I met him. He was very abusive. It really affected my kids. They have no relationship with them. And another person, my husband was a very, very controlling person. I did as I was told. I was like his child. I was cutting out the things that were good and it destroyed me. I was blocking all the bad things out. My son said to me, this isn't right, you have to leave. So this was an eye-opener for me. So while we extracted the themes, and the key theme really here was the whole notion of epiphany moments, there were certain statements, for instance, that these service users made around their husbands being mentally abusive, or where there was very big issues within the family in relation to self-esteem, no self-confidence, and we also mapped the relationships, if you want, between these factors and the previous life experiences as they describe them. There were also lots of moments where participants described this notion of finding inner strength. And so there was an epiphany moment of something happening, which was part of the biography of becoming homeless, which often related to multiple oppressions that were experienced since childhood. But there was also this moment of when they found their strength. And interestingly, the homeless women who were interviewed talked about the service and the role of the Good Shepherd in relation to this, which was really testimony, we think, to the working of the staff, where she talked about, I'm a far stronger person than I was. I wish I had the confidence. I should have stayed with them for a week instead of wasting my life. The staff members were great in supporting me, so I know I don't need them, but that's very, very powerful. I was so messed up in being that relationship, and being here has showed that to me. And just to say, the Good Shepherd Cork, they operate a targeted service, but it's also very much a wraparound service that's targeted at the specific emotional needs, the physical needs, the well-being needs, and drawing on the notion of well-being as a multidimensional concept, which was part of the reason, again, that we chose Sarah White. So a staff member, for instance, complexity of emotion emerged very strongly, and a staff member talked about this in the context of her conversations around her experience of working with people who find themselves homeless, where she said, everyone who comes in the door is uncertain, they're overwhelmed, I would say afraid, they're thinking, what will the social workers do? Will they take my kids? I think we all know what the stigma or the ideal stereotypes around homeless people are. I don't know how many people I've met here that say we didn't think we'd end up in this situation. So there's an element of shame to it as well. So one of the things that we're exploring in the context of a paper is the complexity of emotion. What happens when a prospective service user walks through the door of a homeless agency? What happens? What's the feeling? What's the complexity of emotions that are ongoing, not only within the service user, but also during COVID-19, where there were so many difficulties and issues to do with home working, to do with the separation of home and family, also for workers themselves. And we found that within the Good Shepherd, people were very open in terms of talking about these emotions and these deeply emotive experiences that they had. And some people refer to it as coming to work as being a type of sacrifice that they made to help other people, and also, of course, to earn a living. But they talked about, for instance, in relation to families not wanting to infect family members who were vulnerable or maybe immunocompromised, and also in some situations talked about the fear that they had of the virus as well for themselves. So COVID was not easy, we all know that, but there was a multiplicity of emotions in terms of how service users and the Good Shepherd work together, which hasn't really been brought out in the literature. So there were a lot of things that service users talked about in relation to the experiences that they had before they became homeless, but also the experiences that staff members themselves had, for instance, in relation to the pressures that are on them as in relation to the system. So one of the things that they talked about, we had one person who said, for instance, this was like a volcano. COVID was like a volcano that was waiting to happen, and that when the volcano erupted, there were impacts not only just on the self, but also in relation to the organisation and other homeless providers across Ireland and internationally as well. So they talked about the multiplicity of factors that lead people into homelessness. And this was to do with things like very unsustainable rental prices in Ireland, high levels of precarity in the workforce, troubles at home, so biographical or personal troubles, but also about the drug scene and the changes in the drugs landscape in Ireland, and landlords creating situations where there was extortionist rent. So when they talked about COVID as being a volcano, they were also talking not just about the disease, but also about the eruptions, as one person called it, in the housing market in Ireland, that this was a volcano that was waiting to spill over. And there was a lot of, even though they were generally very positive about the future, they were also fearful for their own futures, not just in relation to COVID, but also in relation to the service itself and the ability of the service to cope with rising homeless numbers. So COVID has multidimensional effects, and in the book with Maggie and Ludmilla, we talk about this as like a giant shard of glass which just shattered during COVID. And I always imagine the shard in London, if, you know, God forbid, it ever exploded, this is what COVID would look like, where each shard is a different shape, it's a different size. We've no idea what sequence, if you want, the explosion happens in. We just know that there was a social explosion, if you want, for want of a better term, where our rules, our social conventions were totally suspended and changed for a period of time. And so service users talked about this multidimensional effects of COVID, as did service providers in the context of the interviews. And there was sometimes a sense of fear, a sense of foreboding, but also planning for the future, wanting to do right by people. And this notion of doing right and supporting people came through very, very strongly in the staff interviews. So we had some staff, for instance, that said, we won't know what's happened during COVID for years, how it's impacted on well-being and in terms of domestic abuse. And the trauma that has on families and on future generations just isn't really clear. And they also understood very strongly from working every day with service users, but also from hearing on the news, from hearing in everyday conversations about the stresses that there was and the reasons that women often became homeless during COVID. to do with partners working from home, the intensity of the situation, and maybe even during that period of reflection. If COVID did anything for us, it made us reflect on the types of people that we were. Most people stood back, at least for some period of time, to think about the self and what we were moving towards. And so some service providers talked about the significance of COVID as a period of reflection as well, why these types of assaults were happening, why people were assaulted and were being put up with it. We talked about the fusion of ways of working of the staff, and I put this picture up of the halogen collider because that's in a way how I think about the ways of working during COVID. Like, we're moving down a tunnel really, really quickly, totally into an unknown future, in a disease that had no past because it was unprecedented, to a place where we didn't know, was it ever going to stop? When was it going to be over? And in the book with Ludmilla and Maggie, we talk about this sense of futurity and unknown futures. So staff reacted very well during COVID, despite the fact that there was huge pressures, there were changes to ways of working. In general, we found that there was high levels of flexibility in relation to how staff worked. So we had staff members who said the Zoom calls came in, the phone calls came in, talking to colleagues. I amalgamated all of that in my ways of working. And I learned how I could be better as a worker, what was happening emotionally to me, and how I could improve all that was going on for my colleagues as well. So there were high levels of teamwork. And people talked about the significance of this teamwork and this peer support. Something that came up in particular narration very often was the notion of the world won't stop. And this is epitomized, for instance, in this interview. The world won't stop. It's not my way of working that I can work for months on end, because my job, one thing I knew from the 2 weeks that I was off was trying to build relationships with people. It just wouldn't work. It would die a death. My mental health would probably fall too. I couldn't sustain that. And colleagues in Good Shepherd as well, interviewees, talked about the significance and the impacts on mental health, not just of the service users, but also of themselves. Their mental health deteriorated, and that happened with staff too. The service users, colleagues, there were a lot of similarities in terms of what happened to them. Their joy in life was gone. In general, we found that there was high levels of organisational adaptation on behalf of the Good Shepherd Cork in relation to perceived trust in staff abilities. Management trusted staff to perform their jobs very well, and this impacted positively on job performance, and staff appreciated that. There were also peer networks that were informally organised, which were very, very significant in terms of offsetting mental health issues. And also new initiatives like forms of art therapy that were run online also seemed to have very strong effects on service users themselves in terms of dealing with personal traumas. There were also examples of interagency working in good collaboration across different services, although we do critique this a bit in the report and put this forward as an implication and as something for the Good Shepherd to work on in the future. We found that the staff team were diverse, there were high levels of peer support, people worked flexibly, and there was also an impact, or an interest rather, and an understanding of the importance of biographical lifeways, pathways into homelessness, the complexity of this, that there was no solid one path, no solid one size fits all approach, and that the needs and the ways of working had to be adapted to particular situations. And we found that staff did that very well. There were also very strong discourses of emotional drainage, which emerged from the interviews with staff, and the notion of it's 24/7 and it's never ending. And staff talked about this quite a lot in the interviews that they gave us. So one woman, for instance, said there's a lot of pain, it's very, very real. And we also had staff that broke down in tears during interviews where they talked about this pain and this feeling of pain. And we had some interviewees that talked about, I feel their pain because I understand their pain. I've been talking to them for, working with them for however many months. I worked with their mothers, I worked with their fathers. There's a huge amount of intergenerational homelessness here. And they also talked about Christmas as being a time of giving and a time of celebration, you know, but at the end of the day, they say they still wake up homeless. There's no talking around it, or there's no getting away from it. So even though the generosity of the community was something that was really important for the service in terms of sustainability and in maintaining those community links, in essence, the service the service providers, the staff, felt very, very much under pressure, and that at the end of the day, this was a never-ending task. And we also had another interviewee who said they're in a pressure cooker, and at times people blow, and they blow at each other. And we had instances, for instance, of violence in the service, which were relayed to us as well. So this woman, for instance, says the pressure of COVID was too much. Imagine having that in a situation where you're living with that person 24/7 in a small unit with no privacy. So that's really hard, and they really squared up to each other. And we would also find that this would come across in other qualitative studies in other homeless services. So biographic narrative interviewing techniques, we conclude, are very significant for the understanding the multi-dimensionality of well-being and of lifeways that connect simultaneously to well-being. We had a small sample, and I alluded to this earlier on. In the end, we had 2 service users who spoke to us and 10 service providers. So we had a very small sample of 12. But we in using a story type approach and in asking people specifically to tell stories about particular life events, we were able to go much deeper into people's lived experiences than we would if we had used a general semi-structured interview approach. And we conceptualize everyday life events as something that is very exceptionally complex, exceptionally deep, and related to the individual biography, but also as relating to organizations, the macro level, policy level, etc., as almost like Matryoshka dolls. We found that in looking at our results from a macro level, an organizational level, coping strategies were very effective by the organization, and we commend management for that. Staff members' personal coping overall was very good, but at times it was compromised by things like workplace violence, higher expectations that they felt were put on them by society to help cure the homeless crisis, and the feelings of powerlessness to effect real change. We also recommend in the report that the Good Shepherd operationalizes and trains people in trauma-based working for staff and also service users in digital skills, which will help with future pandemics. It's also important to note the significance of perceived social support, and that this had a huge transformation, had very much a transformative effect in people's lives, and that this is significant for breaking cycles of intergenerational homelessness, which was regularly reported. As we talk about this in the report, it's very significant that there are particular measures that are enacted at the level of the service and also at the level of local government and national government as ways of adapting to the longer term effects of COVID-19 and also in terms of adjusting to future pandemics so that we're able to hit the ground running if we're ever in a lockdown situation again. We think that based on our analysis that collaboration with local government and other homeless agencies is very, very significant if this was deepened for Good Shepherd Cork. And we talk about in the report the significance of biographies, narrative approaches, in seeing this well-being concept as tentacled and as understanding how these tentacles link to each other and how they link back to different dimensions of well-being. And we think that this yields very important conceptual and methodological avenues. So to say a word of thanks to Professor Joe Crotty, the Director of ISR, my friend and colleague, Dr. Victoria Foster, Professor Tom Coburn, who provided input on the ethics application originally, Professor Mark McGovern, who also did the same, my very good colleague and friend, Dr. Lorraine Green, Dr. Zana Vathi, who had also provided feedback on the ethics, and also my colleagues and friends at the Department of History, Geography and Social Sciences at Edgehill. Thank you.
Thank you so much, both of you. It's such interesting research. It's like a really, really worthwhile project. I think your findings are just so insightful. So please, everybody, feel free to type a question or a comment into the chat. If you're very keen to come on camera, then you are welcome to put your camera on and ask a question. But if you don't want to, then just type them into the chat and I can ask Lisa and Liam on your behalf. While you're having a think about that, so I've got a question.
Thanks.
What I'm really interested in is the process of doing the interviews. So I think, you know, the findings are just so startling. You've got such sort of emotional and sort of intimate data there. So how, and you say that you did them on Zoom and over the phone. So you never met people face to face for these interviews?
No.
So how did that work? How did you manage to get that level of storytelling in that virtual way?
Well, I might take that question first, if that's okay, Liam, and then ask you to come in. So yes, we never met. We never met even our Good Shepherd colleagues and friends who are here today. We've never met them face to face. And just to say that Liam and I have also never met face to face. All of this is being conducted entirely online. So a couple of years ago, I published research with Anna Catano in the University of Lisbon on the contextualities and the complexities, if you want, of interviewing in online situations. And we were also very aware of the possibilities of triggering particular types of emotions when we were interviewing people who were so-called vulnerable population. So we took that body of literature, if you want, to bear on the on how to do a good online interview in a way that it doesn't compromise the quality of the data, but it also means that you were being ethical with the participant. And so CITES 2016, for instance, talks about how there are certain non-verbal cues that you should use when you're using online approaches, such as, for instance, if a person has the camera on, look at their facial expressions, look at what they're doing with their hands. You know, so it's like tuning in to that sixth or seventh sense in a greater sense than what you maybe ever have had before. And during COVID-19 in Research Network 03 of the ESA, we had extensive discussions on the complexity of doing online interviews. So we knew it was already a very complex situations, and there was high level discussion and dialogue that was going on at a European level, I'm sure in the BSA also, in relation to online interviewing. So we understood the international perspectives and some of the pitfalls of doing online interviewing. So for instance, if people choose to keep their cameras off, what do you do? How can you compensate? Is there a way of compensating when you can't see the facial expressions of the person? So we also used the work by Gabriela Rosenthal in relation to triggering, and she talks about finding safe spaces in the narrative. So for instance, that when you're interviewing members of a so-called vulnerable population or an at-risk population, you find places in the narrative where you can see, using the what they say plus the non-verbal cues, where they feel safe. And so we tried to bring people into that safe space for the people that were interviewed online, to try to deflect from this kind of triggering or the risk of triggering, but also focused on the non-verbal where we could. In the situations where we had people who were interviewed over the phone, particularly service users, we took them very much as we found them. So in some situations, I remember ringing a woman one day and she said, look, I can't talk to you right now, but I can talk to you in 15 minutes if you ring back. And I phoned her back and she said she was in a better place. She was in the service at the time and she could talk a little bit more. And so I operationalized the same contours, if you want, of the interview around trying to bring her into the safe space, the things that made her feel good or the things that made her happy. So when she talked about something during the interview that made her happy, I tried to bring her back into that space later on.
Right. Can I jump in and say we've had a question from Alison which relates to this, and she wants to know whether some of these ethical considerations that you've been talking about in terms of the interviewing and being not being exploitative, not being extractive, how they might have implications for interactions with service users going forwards.
Yep.
Do you think there's something to be said there? You've got about a minute to say it.
No problem. Yeah, Liam, maybe you want to answer a question. I don't want to be hogging the whole conversation.
Well, I had something to add to the last point, but now I'm trying to think about this new topic.
Do you want to answer the last point and then I'll think about
Yes. I just to build on what you were saying, Lisa, and to respond to you, Victoria, also, we do note in the report that there is a lot of information that is lost by doing online or telephone interviews. So it's not that we got all this amazing emotive material and we've proven you don't need in-person interviewing, because actually a lot of the, that's Lisa's area of expertise, is the sensory research, or some of the aspects that we're missing. But yeah, definitely there were a lot of challenges as well with doing online interviewing, and that's not to say that it's appropriate to approach this sort of topic always with online only. I think we both would have liked to actually be able to do this in person, but we had to adapt to the situation. And while there was a lot of good that came out of it that showed actually digital technology can be useful in this kind of setting, it's not to say that therefore we should continue doing only digital projects. I think that would be something Lisa would agree with too.
Yeah, no, co-presence is key. Like, I think if you can, ideally, if you can do this type of work in a situation where you're sitting down talking to someone, because you do still lose a lot of information online. I mean, you don't know who's behind a person if they've got a screen up, you don't know who's being coached. So I think it's a really, really important question. And
whether they can be overheard, whether there's someone in the room with them, these kinds of things.
And that's more troubling in some respects if that's the case, so when you're dealing with vulnerable groups. And then Alison asked a question around the kind of biographical perspective, if I'm right, and maybe how some of these key principles can be pulled out. Is that her question?
I think about the ethical, it's more about sort of the ethics that you've talked about, sort of thinking about not exploiting people through that process.
Yeah, okay. So I suppose, first of all, Alison, we always saw the Good Shepherd, as as our collaborators, and not just as our collaborators, but in many ways as our co-researchers. And we encapsulated our participants very much in the same way as collaborators in these types of conversations about their lives. And we're very cognizant of the huge injustices and oppressions that these people had endured throughout their lives, and had a huge respect for them. So as Liam says, there tends to be often the type of research relationship where people go in and they collect the data and they mine the data, and then they take it and they publish it, and there's nothing more for the service users themselves. And I'm conscious, I suppose, of the fact as well that we haven't had an event in Good Shepherd, but I think it would be lovely for us to have another type of follow-up event. And maybe, Liam, this is your chance to come to Ireland now as well, in terms of bringing the results back to the Good Shepherd and back to the people who helped us, which is yourselves, and also the people that reside in the service. So I suppose in terms of ethical principles, ethics is an ongoing conversation. So it's not just something that happens at the beginning. It's often seen as something that happens at the start of the project, but actually ethics is a way of being. It goes on long after a report, for instance, might be written or published, etc. So I don't know if that answers the question, but
perhaps to add on that, Lisa, as we mentioned in the report about the importance of a trauma-informed approach, so that's kind of a way of doing practical ethics, is adapting the service and the pathway to the individual, rather than just having a sort of a standardized process that people move through regardless of their individual circumstances. So and as we mentioned in the report, the changing demographic of people who are homeless means that an ethical approach has to be tailored to, somebody might have domestic violence or intergenerational homelessness, whereas somebody might be in work and just unable to afford housing. And so there's going to be a very different meaning of what is ethical in those situations. It's going to be informed by the trauma of that individual.
Yeah, and ethical judgments relate back as well to the complexity of people's biographies. So to be ethical means to understand the standpoint of the person, but you can never really understand the standpoint of another human being, but you can understand it more if you're working with somebody for long periods of time. And we found that there was a lot of continuity in terms of the relationships that were built up. And there were staff, for instance, who talked about the intergenerational aspects of homelessness and understanding the person's biography, not just understanding the person and where they are now, but where their mother or their father was 20, 30 years ago at a similar age of their lives when they found that they had become homeless. So this kind of biographical continuity was key.
Thanks. Yeah. Can I say a word?
Sure, yeah.
Very quickly.
Well, and thanks very much. It's really interesting to hear your research, and in a way to be able to sit back and sort of see the whole picture of it. Yeah, I suppose my question there around, I suppose I'm thinking that in a way we're very good. Sorry, my phone. I think we're very good at talking to people, but it's in a very experiential sort of way, or it comes from experience of colleagues. Whereas it seems to me there's something perhaps a bit more sort of scientific from your perspective in the extent of thinking you've put into how to interview people and how to communicate with people. And I suppose it's just, I'm wondering if there's some learning there that, some nugget that we might take away. But look, what you've said is helpful. I'm just putting a bit of framing around my question. But overall, I wanted to say, really thanks. It's been a very positive experience and valuable for us to be able to have your perspective and an overview of what we've done and how we did it through COVID.
Well, we were very privileged really to work with you and your team, Alison. So that's a really important point. And you were dream collaborators in many ways. I think there probably is some types of concepts or principles that could be drawn in that might be useful, that can come from the social science methodological research perspectives in relation to the work that you do. But also you need to remember that when people do research, they're doing it for a different purpose than, for instance, the type of deep therapeutic work that some of your staff do. And there are some researchers out there that always say that you need to be very, very mindful of these types of boundaries, that you are there as a researcher, even if you are actually a therapist or a clinician in your spare time, you are there as a researcher. So the relationships are often very, very different. And there is a body of work out there on using these type of biographical approaches for therapeutic purposes. And I know you've written on arts-based research as well, Victoria, and that can be used for therapy. But it's a literature, to be honest, that I'm not an expert in. And it's not a literature that I've read an awful lot about. I have read some things about it, and it's really, really interesting, but I'm always very cautious. I'm in the space of the researcher, and that's what I'm there to do. But it was absolutely fantastic collaborating with you, and hopefully we will get the chance to come to the Good Shepherd and reveal our results in person.
Yeah, I hope so.
Yeah, we'd love that. Yeah. Thank you.
Great. Well, thank you all so much. We've got a question, well, a comment and a question from Linda. How can people access a copy of the report? I think it's on the ISR website now, isn't it?
It is.
And Linda, I can email you a copy too.
Brilliant. And Linda, yeah, we're very happy. We can give you a copy of the presentation, an abridged version, and you can share it with the staff. And as I said, Liam and I are very happy to come. So we can reuse this presentation in the future, Liam.
That's great. Thanks, Lisa. I had just asked if maybe we might be able to get a copy of the presentation, because it'd be great to share it with the staff.
Oh, it was the presentation you wanted a copy of.
Particularly the staff who took part in the research. I think they'd like to see it, just in case you don't get to Ireland.
Oh yeah. Well, I'm in Waterford at the moment and just moving to Athlone soon, so I'm here, and Liam has to get himself across the Irish Sea sooner rather than later.
Right. Well, we're a bit over time, so I think it's time to wrap up.
Thanks,
but thank you all. I hope we'll all meet in Ireland before long.
Thank you.
Thanks very much.
Okay. Have a lovely
evening, everybody.
God bless. Bye-bye. Thanks, Victoria. Thanks, Liam. Thanks, GSC. Bye-bye.